Welcome to Empowering Voices Advocacy in Action, the podcast that amplifies the voice of patients, advocates, and healthcare leaders driving change. Together, we'll explore stories, strategies, and solutions to empower you to make an impact. Let's turn advocacy into action, starting now.
Hello, and welcome to Empowering Voices, the official podcast of Heal Canada. This episode is part of Heal Canada's Iron Deficiency Anemia Patient Advocacy Initiative in partnership with 360 Life Sciences Consulting and supported by Pfizer Canada. This is your host, Hisham Younes, on behalf of Heal Canada, and I'll be speaking today to our guest, Rayan Seifeldine. Rayan is joining us today to speak about her journey as a patient living with iron deficiency anemia. Rayan is a mental health specialist, moved to Canada 5 years back with her husband and 2 kids. She is also the founder of Hiya Arabia and the creator of WAM Therapy, both platforms to help women feel seen, heard, and empowered to rebuild their lives with confidence and purpose. Hi, Rayan. Thanks for joining us. I have some questions that would be beneficial to patients living with iron deficiency anemia, especially you sharing your experience as a patient yourself.
Hi, Hisham. Sure.
Okay, to start with, Rayan, how is it like to be living with iron deficiency anemia?
Well, iron deficiency anemia, it's not just feeling tired. IDA actually affect every part of my life. Even when I want to fully present with my kids or take care of some house duties, even my workouts, my physical strength, my hair, my energy, my mental health, everything feels connected to this. Some days I want to show up as my full self, but my body doesn't meet me there. And that's the hardest part. Not just tired, but feeling like you are not fully there in your own life. It's also demanding people around me. I know for sure that without my husband's support during this time, it would have been much harder for me. So I wanna thank him.
Wow, let's hope he's tuning in. Thank you for that, Rayan. Um, Tell us more, how does it feel like to be a patient with iron deficiency anemia? Like, how do you describe it? Very interesting what you're saying.
With the IDA, I feel like iron deficiency anemia has two sides. One physical affect like my physical life, workouts, small things. I feel tired, drained. My body just doesn't have the energy. And the other mental side, because that tiredness pulls me away from my life, especially my social life. Can't always go out, meet friends, have a simple coffee. Sometimes I just don't have the energy to connect with people. And slowly, it starts to feel like isolation. Like I just need to stay in bed and take a break from everything.
Wow, that's a big impact on your life. I guess you described it really well, not just physical, but also mental. It's definitely more than just being tired. Yeah.
Yes, so I feel living with iron deficiency anemia, it's not just physical tiredness. It also affects my mind. When my iron is low, I can feel it. So I feel low energy, low mood, and I get easily overwhelmed. Even I can't focus the same, and I start feeling mentally exhausted too. I actually have mood swings during the same day. Because of that, I avoid going out. I cancel plans, and I don't always have the energy to connect with people. Slowly, I feel more and more isolated. This cycle can affect mental health and even lead to feelings similar to depression. For me, it's not just tiredness, it's how my body and mind are both affected at the same time.
Wow. So iron deficiency anemia affected both your body and your mind at the same time.
Yeah, and even my beauty, like my hair, my skin, my nails.
And Rayan, when did this journey with iron deficiency anemia start?
It's a long story. But it's my journey with iron deficiency anemia started a couple of years back. When I felt very tired all the time, it was not normal tiredness. It was deep exhaustion. I also started to see changes in my body, especially my hair was falling more than usual. My nails were weak and breaking easily. My skin looked pale, tired, and not as bright as before. My face didn't look fresh like it used to.
I guess that's what you meant when you referred to like affecting the physical appearance.
Yes, at the same time, like I felt it's not only my body, even my mind was also affected. I had brain fog. I couldn't like think clearly. I was forgetful and my mood was low and I couldn't easily get upset. I didn't feel like myself. At first, I think it was just stress or being busy as a working mom. So I kept pushing myself and ignoring the symptoms. But deep inside, I knew something was not right. It's not me. So this journey with IDA officially started when I went to my doctor and told him my symptoms, my physical symptoms, my mental symptoms, and what it's happened to my body, my skin, my hair, and everything.
Hmm. And how did your physician come up with the diagnosis? Like, how did he pick it up that it is iron deficiency anemia?
He asked me to blood tests, especially for iron and ferritin. When the results came back, my ferritin was around 8. It's very low. It's explained so much I was always tired, weak, and sometimes dizzy. Even simple things felt heavy for me. Mentally, I felt drained, unfocused, and not myself. When I was diagnosed with ADA, I felt both relief and worry. Relief to finally understand what was happening, and worry realizing how much my body has been struggling quietly. I also realized that hadn't been listening to my body and the signs it was giving me. I started thinking about the next steps and I felt a deep sadness for the version of my life before the symptoms.
Oh, that's quite the journey from the symptoms to diagnosis. Ryan, could you tell us more what treatments for iron deficiency anemia have you been prescribed since then?
Yes, of course. My family physician started me on iron pills and suggested changes in my diet. So after about 1 to 2 months, my levels improved and I reached around 10. I felt a bit better. So I continued the treatment for about 6 months. During that time, my body and energy improved a lot and I felt more stable. But after 6 months, the symptoms came back even stronger, especially after my workouts or any physical activity. I felt worse again, so I went to the emergency room.
Wow, who would have thought that iron deficiency anemia can bring you to ER? Tell us more.
But they told me to follow up with my doctor and consider iron infusion. I had the iron infusion and it really helped me feel better mentally and physically. It's made big difference in my life, especially as a woman dealing with monthly hormonal changes. The iron infusion helped me, but the journey to get there wasn't easy. Navigating the healthcare system took time and a lot of energy. I didn't really have at that point. Infusion itself wasn't simple either. I experienced sides of effects like feeling suddenly hot and cold, changes in my blood pressure, and deep fatigue for about a week afterwards. But despite all of that, it was worth it.
Hmm. So currently you are on iron infusion, and how is it like now for you?
Slowly, I started to feel like myself again. My energy came back, my focus improved, the hair loss reduced, and even my skin looked healthier. It felt like my body was finally being replenished. after being empty for so long. It is an expensive treatment and not covered by public health care. I was lucky that my drug plan covered it, but I'm very aware that not everyone had that access. For me, it wasn't just treatment. I felt like a turning point in getting my life back, finally. And now I'm continuing to manage my iron with pills and follow ups because keeping my iron and ferritin stable is very important for my health and daily life routine. I'm still taking infusion based on my doctor suggestion.
Wow. Like when you say it wasn't just a treatment, it felt like a turning point in getting my life back again, finally. Wow. It's interesting because this medication is not available for everyone. So I guess that's a barrier for access for many, many patients. Thanks for sharing that, Ryan. Now, from your experience again as an iron deficiency anemia patient, what would you say to people who are experiencing symptoms that could be those of iron deficiency anemia that they're not sure?
For every person who may be living with iron deficiency anemia, and especially women, please don't ignore your body. If you feel tired all the time, low in energy, forgetful, or not like yourself, it's not something small. It's your body asking for help. So you have to go check your iron and ferritin levels, follow ups with your doctor, and take your treatment seriously because your health matters. But most importantly, be kind to yourself. You are not lazy, you are not weak. You may just be low in something your body truly needs. Rest, heal, and give yourself permission to slow down.
Wow, that's a powerful message for self advocacy when it comes to your health. And thank you for sharing your story, Rayan. This is so insightful. I know that there are a lot of people out there struggling with iron deficiency anemia, or they have the symptoms, they're not so sure. And also, this is affecting them, affecting people around them. And hopefully, our conversation today would help them navigate life with iron deficiency anemia. Again, thank you so much, Rayan, for being with us and sharing your experience.
Thank you for having me. And really, it's important topic and to give like people aware regarding the IDA, especially women, because it's really important to our life. And even it's very similar to the depression symptoms. So you have always to check your ferritin, and your vitamins, mineral, and everything because your life matters for everyone.
Thank you so much, Rayan. This is so insightful. And what a message to close with, really, of self advocacy, especially when it comes to iron deficiency anemia. I know that there are a lot of people out there struggling with iron deficiency anemia. They're not aware. Maybe they have the symptoms, they're not diagnosed yet. And also people who have been diagnosed and they're navigating life with iron deficiency anemia for them and for people around them. So thanks again.
Thanks for having me.
Of course. Thanks everyone for tuning in. This has been Empowering Voices, the official podcast of Heal Canada. Please follow us on all the platforms for Heal Canada and follow us on all the socials of Heal Canada. This episode was supported by Pfizer Canada and was in collaboration with 360 Life Sciences Consulting. Thank you. Bye bye.
Thank you for joining us on Empowering Voices Advocacy in Action. Stay inspired, stay informed, and keep advocating for change. Together, we're stronger, amplifying our collective voice. Don't forget to subscribe and share. Your voice matters.